everyone. My name is Katie, and I'm with the Arthritis Patient Advisory Board in Vancouver, BC. And we're here today at the CRAs and to talk to Victoria Chu from Toronto. And she's going to give us some insights about what she thinks about the conference and a little bit about herself. So Victoria, can you tell us a little bit about yourself and how you're involved in the field of rheumatology?
Sure. Thanks for having me. I'm a first-year resident in the internal medicine program at University of Toronto, and I first got involved in rheumatology as a medical student when I had the opportunity to do the CRA studentship program in the summer, and it was an excellent opportunity to sort of get a glimpse of what being a rheumatologist is all about, and that kind of got me hooked on the field. And this is the second CRA conference that I've attended, and I was happy to be here to present an oral presentation yesterday.
Nice. And what was it about rheumatology that got you hooked?
I think a lot of sort of aspects of rheumatology are very appealing. The first is definitely the medicine itself. So the conditions that you're diagnosing and managing as a rheumatologist are very complex and multi-system. It's never just about one organ system. It's kind of looking at the whole person. And I think it's also very rewarding because unlike a lot of sort of subspecialties in medicine where you're predominantly working in an inpatient environment, there's a lot of outpatient work for rheumatologists, and you develop long-term relationships, very meaningful and sort of longitudinal relationships with your patients that you follow over many years. And you can see sort of their response to treatment and how they're doing all throughout their disease course.
Mm-hmm. Yeah, it's a long term.
Yeah.
So you said you were presenting. Could you tell us some of the key takeaway messages from your presentation?
Sure. So yesterday I presented during the Clinical Pearls and Mysterious Cases session in the evening, and I had a case about a patient who had psoriatic arthritis, but then presented with some new nodules in his arm, and it ended up being an infection that's pretty rare, Mycobacterium marinum, and it's it happens in people who work with fish, so he actually had aquariums at home. So it's kind of an interesting case to share with my colleagues, and I guess one of the take-home messages was that many things can mimic arthritis, including infections, including rare ones, so it's very important to think outside the box when you're kind of meeting some challenges in diagnosis, and also to listen to all aspects of your patient's life. So in this patient, his hobbies, having like 4 fish tanks at home was very key to finding out the diagnosis.
Right, yeah, sometimes as patients we think every new ache or pain could be something related, but it's obviously not always the case.
Exactly.
So what do you think is the most exciting and important things happening at the CRA this year?
I think a lot of exciting things are going on. So far, looking back, although it's kind of we're halfway into the conference, so far I've really enjoyed that exercise talk by Dr. Fowles. I think it shed some light on some of my own questions as a physician about how to talk to patients about exercise, how it's so important, and also made me reflect on how I should be exercising more to meet the 150 minutes a week of aerobic exercise.
Yeah, it was a good talk. And aside from that, what do you think about the use of social media this year in relation to patient care and medical research, and even what we're attempting to do right now, reaching out to a wider audience?
I think it's very exciting and sort of new, definitely, to the field of medicine. We just had a talk at lunch about social media, so it's kind of fresh in my mind. But personally, I see like Facebook and Twitter as a really good way for patients to get messages across for patient resources and patient education. It's also a really good avenue for advocacy. And then personally, I use Twitter and Facebook a lot to follow like the latest literature. So like following, for example, the journal JAMA Internal Medicine. On Twitter, I can just see the new publications and the summary in one line rather than searching myself and reading pages and pages of medical literature.
Yeah, it's becoming a little more convenient.
Yeah, it is.
And where do you see arthritis treatment, models of care, and healthcare going in the next 10 years or so?
I think one of the things that has been highlighted to me through my rotation so far is the importance of like team-based and multidisciplinary approach, especially for people with arthritis who definitely have complex medical needs, but also their treatment hinges as well on lifestyle aspects like especially physical activity, physiotherapy, rehabilitation. All these components are really important. So I think we need models of care in the future to better integrate the multidisciplinary approach, have great collaboration among family doctors, rheumatologists, but also allied health professionals like physiotherapy and occupational therapy.
Right, and do you see that starting to happen in real life?
I've definitely seen it in certain aspects of medicine, like a family health teams are a great example. In terms of the rheumatology clinics so far I've worked in, it's less sort of, the allied health are available, but it could be sort of improved in the future, I think.
Okay, and finally, what lifestyle tips do you have to offer anyone with arthritis?
Lifestyle tips. So obviously exercise is very important, and I like to emphasize that it's not about, booking out 3 hours a day to go to the gym. A lot of it's just about how you can incorporate activity into your daily life. And I have a hard time doing it as a busy resident right now, but a lot of it's about being less sedentary. So if you can stand, don't sit. Also diet-wise, my philosophy is just everything in moderation, so that kind of speaks for itself. And I'd like to highlight sort of emotional and mental health as well. It's a huge area that I think even in, for rheumatology is important too. So, having a good positive social circle, keeping up with your hobbies, taking time to reflect once in a while are all good things for lifestyle tips.
Yeah, I think the emotional and mental aspects of arthritis we sometimes don't discuss as much as we should, and that could go into the multidisciplinary aspects of practice in the future.
It's sometimes more put to the side when you're in a busy clinic and you only have so long to see a patient.
Yeah, exactly. Well, thank you so much, Victoria, for all your tips and advice. And are there any questions from the audience?
We have one question. Someone was curious about your current rotation. They asked, what do you enjoy most about your current resident position?
Oh, okay, sure. So right now I'm in my, again, first year of internal medicine, so we do get to rotate through a lot of different rotations. Currently, I'm about to start a general internal medicine, so inpatient ward rotation at Sunnybrook Hospital. I really like the teaching involved, the fact that you're working with staff who really love to teach, and also it's my first time being in the teaching role myself with medical students, so that's definitely something I've loved the most about that rotation.
Great. Okay. Thank you so much, Victoria, again, and enjoy the rest of the meeting.
Thank you so much.